Good afternoon, everyone. So without question, these are truly uncharted waters that we're navigating COVID-19 together. This, as you know, has been an extremely busy week, and we are seeing some significant changes within our province. For example, we've seen changes to visitation in some of our long-term care facilities. We've seen operations at bars and restaurants change. We've seen education suspended within our schools and closure within our daycares. We've seen the population, the people of our province, make significant changes in the way they socialize with each other. So I want to take this moment to say thank you to the people of our province for cooperating with the guidelines and the recommendations that we've put in place. Today we will introduce additional changes around the Public Protection Act, changes that we feel are necessary at this time. Minister Hagee will talk about those changes in a moment, but first, there are a few things that I would like to address. There is no doubt COVID-19 is having a significant impact on our healthcare system and our economy. As you know, today the federal government announced temporary restrictions to all non-essential travel across the United States border. However, we know essential travel will continue. Also, an $82 billion package was announced today, and this means more support for workers and businesses as we navigate over the weeks and possibly months ahead. The package includes $27 billion in direct support to Canadian workers and businesses and some $55 billion to allow tax payment deferrals until September for individuals and corporate taxpayers. Included in this is a new emergency care benefit that will provide workers with up to $900 biweekly for up to 15 weeks. These new programs for workers, including the self-employed, and is meant for anyone who is sick, quarantined, self-isolating, or carrying out caretaker duties. So applications for the benefits will be available in April of this year, and you'll be able to access these online and by telephone. A temporary wage subsidy has also been announced and will support businesses and prevent layoffs within our province. As you know, the subsidy will last for 3 months and will equal some 10% of remuneration paid during the period. This could be up to $1,375 per employee, $25,000 for the employer. Employers can also benefit from the subsidy include small businesses, which is important for Newfoundland and Labrador, but also important, the nonprofit organizations and charities are included. There's new changes to allow greater flexibility for taxpayers be able to file on June 1st, 2020 and defer payments until August 2020. For Indigenous governments, the Government of Canada has created some $305 million to support Indigenous communities to address immediate needs for Indigenous communities. The Canada Child Benefit changes up to $300 per child for the 2019-20 year. Also, GST credit changes boosted to $300 plus $150 for each child. Now, this afternoon we had a long conversation with my other Canadian premiers and with the Deputy Prime Minister, Chrystia Freeland. One of the things that I stressed again today on my call, as I did last week with the Prime Minister, is that this is not a one-size-fits-all, meaning what works in one province or one territory does not necessarily mean that it will work for Newfoundland and Labrador. And in saying that, discussions on the federal and provincial level, as they have been extraordinary. This is not a time for politics. It's a time for cooperation and collaboration. Canadian premiers will continue our open dialogue with the Deputy Prime Minister on a daily basis. These are tough times. We saw today oil reached historic lows in our province, and we're seeing investment being deferred on many projects. My message to the federal government is it's urgent to get this money moving. Additionally, our government will be extending a 3-month deferral on loan payments to all tourism, culture, industry, and innovation clients with business loans with Innovation Business and Development Corporation. The COVID-19 situation continues to evolve, and we will continue to make changes. And we will continue to put protocols in place, whether it's on an hourly, daily, or sometimes on a weekly basis. We know that some of the swift decisions may not always be perfect, but this is about preventing the spread of COVID-19. We're making these changes with your health and safety in the forefront. We have to work together. We have to continue to wash our hands, practice social distancing, and ensure that health and safety of ourselves and our loved ones is a priority. Once again, I would like to thank Dr. Fitzgerald. She's been working tirelessly on behalf of our province. And as Premier of this province, I appreciate the work she's doing on behalf of our government, on behalf of Newfoundlanders and Labradorians. At this point, I'd like to turn it over to Minister Hagee, who has also been working tirelessly on behalf of our government and behalf of Newfoundlanders and Labradorians. It's been a team effort. So to you, Dr. Hagee, thank you for being here with us again today, and you can make your comments on the health aspects and social responsibility. So thank you very much.
Thank you very much, Premier. This is an unprecedented time. We are guided very much by the expertise we have in Dr. Fitzgerald and her team of public health doctors. You may recall in 2018, we went from having the oldest public health legislation in Canada to some of the newest, strongest, and most nuanced legislation in Canada. So with effect today, and on the advice of Dr. Fitzgerald after multiple conversations, under the Public Health Protection and Promotion Act 2018, I have signed the first declaration of a public health emergency in this province. What that does is it enables the force of law and regulation to be applied to what were previously recommendations by an appropriately designated medical officer of health, in this case, Dr. Janice Fitzgerald. We have heard concerns about people and businesses who may not have acted as responsibly as we had hoped they would. By and large, the level of compliance with our recommendations has been high, but again, our opportunity to flatten the curve is now, and we are seizing that. This order, this declaration, enables penalties and consequences for non-compliance, and these are amongst the most severe of any of the public health legislations in Canada. For example, for an individual, for their first incidence of non-compliance, a fine of between $500 and $2,500, or a prison sentence of less than 6 months, or a combination of the two, could be incurred by being in breach of the orders that we will be announcing under this Act. For corporations, the fine would be anywhere from $5,000 to $50,000. I can't read my own physician's handwriting here. And directors in corporations would be held personally liable and susceptible to individual penalties as well. These are then multiplied for subsequent offences, and that essentially means that for every day an individual or a corporation is not in compliance, that is a new and separate offence for as long as it continues. These are significant penalties. We hope we never have to use them, but they exist, and if necessary, we will use them. From this novel decision in unprecedented times, I just want to move on to a couple of things, and probably the hardest decision that we have had to make concerns visitation restrictions for our vulnerable, our sick, and our elderly population. There is no doubt that these will cause distress, and they've distressed me, quite frankly. But again, the acute care facilities have restricted visiting to obstetric, to end-of-life issues, and to children who are admitted. The security at hospitals has been improved to reduce the number of points of access and to allow for policing of this. There will be recommendations about the size of gatherings, and we've heard through social media about bingo halls and these kind of events that continued as recently as last night. And these, in the interests of the health of all of us, must cease. Today, in consultation with the Pharmacy Board, it became clear and was announced that pharmacists have the ability to refill and extend prescriptions under their own scope of practice. And this then removes the requirement for people to go to physicians' or nurse practitioners' offices to get their prescriptions refilled. So this again will increase availability of physicians for those who are ill and nurse practitioners, and reduce the likelihood of crowded waiting rooms, and again help with social distancing. I have received communication from Canadian Blood Services. They are concerned about blood donation. For those of you who give blood, I encourage you to continue to do this in consultation with your local clinic. It is safe to do so, and we will ensure, in conjunction with CBS, that the appropriate protection and social distancing occurs. We have had significant strain on our 811 health line. We have increased the number of lines, and by the next 36 hours, we will have another tranche of 14 new RNs available to alleviate call volumes. But I would encourage everybody to go to the government website, and there you will find a self-assessment tool on our COVID-19 website. You can use that. Those are the questions that would be used by 811, and you can get the answers you need from that website for anyone with access to the internet. I would encourage you to help us use our 811 line itself in a more efficient and effective way. Having said that, I think it's now crucial that we hear from the experts in the field of public health for today's developments, and a little bit more detail about what under this declaration these orders would comprise and how they would work. So with that, I'm going to turn the floor over to Dr. Fitzgerald. Janice?
Thank you, Minister, and thanks everyone for coming. Good afternoon. I'd like to start first with just case numbers and updates. As of today, March 18th, there are still 3 presumptive positive cases of COVID-19 in Newfoundland and Labrador. The number of people tested in the province to date is 590. Of those who have been tested, 587 have been confirmed negative. And there are currently 248 people in self-isolation and being followed by public health. We've been closely monitoring the COVID-19 situation in our province and across the country. Over the last number of days, we have seen the pandemic continue to evolve. The public businesses, nonprofits, and public sector have taken unprecedented steps to ensure that we can protect the health of our population, including our most vulnerable. I thank everyone for their diligence in continuing to adhere to our public health recommendations. We have decided to take the next step to ensure that we are best positioned to protect the health of our population. Our Public Health Protection and Promotion Act has levers to ensure that we can do just that. Today, I met with the Minister of Health and Community Services and recommended that a public health emergency be declared. The decision was made in the best interest of our residents. The recommendation to declare a public health emergency does not come easily, but is necessary at this time to protect our population. We require special measures to respond to the evolving situation of the COVID-19 pandemic, and this declaration enables us to strengthen the public health measures we have already been communicating to the public. These levers enable the Chief Medical Officer of Health to be more rapid and flexible in responding to the changing landscape of COVID-19. Effective immediately, the following types of businesses must close: gyms, fitness facilities, bars, cinemas, performance spaces, and arenas. These businesses are unable to adequately meet the requirements of social distancing. Restaurants that can maintain social distancing can continue to operate at reduced capacity of 50%. Takeout and delivery models can continue as per normal operations. Public gatherings of more than 50 people are no longer permitted under this order. Gatherings under 50 people should be avoided if social distancing is not possible. Effective immediately, any travelers returning from international destinations, including the United States, must self-isolate for 14 days after their return to Canada. We appreciate that many travelers have been doing this already on a voluntary basis. I want to assure residents that we are prepared and our health system is working well and as it should under these pressures. This is another tool in our toolbox to ensure that we all do our part to support flattening the curve. While we are experiencing new and emerging challenges, we know that this is a long-term situation. We appreciate everybody's collective efforts. We must continue to follow the public health evidence. Washing your hands frequently and with soap and water or using hand sanitizer with at least 60% alcohol will help you and those around you stay safe. Avoid touching your face. Stay at home if you are not well. Regularly clean high-touch surfaces such as doorknobs, remotes, and phones. I appreciate that there may be increased anxiety with the declaration of a public health emergency. I want to reassure the public that these measures are put in place not because our situation has deteriorated, but after careful consideration, we feel this is the best way to protect the health of our population and reduce the risk of spread of COVID-19. I appreciate everyone's patience and cooperation during this time. We must all work together to stay healthy and do what we can to manage COVID-19. Thank you.
Now that we've enacted this state of emergency in terms of public health, can you elaborate a little bit on what brought us to this point? We have 3 presumptive cases in the province. Many other provinces, having more, have not declared their states of emergency.
We are pretty well in the pack. I think there's several ahead of us, and as you allude to, there are others that haven't. I think I could do no better than to reiterate what Dr. Fitzgerald said. This is done for ongoing protection. There have been increasing concerns, particularly through social media and email, that have been brought to my attention in the last 36 hours of suggestions of non-compliance. I think really this is an exclamation mark, as I think the Premier said in our discussion earlier on. This is an exclamation point behind what were previously recommendations. These now have the force of regulation, they have the force of law, and recurrent failure to comply is going to cause significant risk of significant repercussions, as stated in the Act. This is done to get ahead, this is done to send signals, and this is done to allow Dr. Fitzgerald the leeway to make changes if we find particular pressure points do arise. We have 3 presumptive cases currently. It would be remarkable, if not miraculous, if we don't get more. This is the long haul. We'll be at this through to the spring.
In terms of enforcing and regulating those who are going to be compliant, who is doing that? And is there a number or somewhere people can reach out for those that they believe aren't being compliant? I know there was a number that went around earlier that we now have learned is inaccurate.
Yeah, that was unfortunately an administrative assistant in public health who has been unable to do her job because that number got out without verification. And if one thing's come out of this, the important thing is that we should have valid information and trusted information out there. And to those of you who've reached out to confirm it, I appreciate that. From our point of view, enforcement is a separate mechanism. It involves other agencies rather than health. It involves Service NL, and we've reached out to them. It involves Justice and Public Safety, and we're reaching out to them. We're looking at mechanisms to make that a feasible and workable thing. We're taking this one step at a time. The first step was to have the levers, and we believe we've got them now.
Premier Wall, just a little further to that question. It was actually a Cabinet Minister, Derek Bragg, who was one of the first to share that number. He has since apologized for it, but do you have any comment on that and him jumping the gun and sharing what was false information?
Well, quickly apologize, the minister did. Of course, and I accept that apology. I mean, there's a lot of information that's going back and forth, and he was quick to apologize, quick to remove the site, the post that he made. So, for my part, I accept that apology. There's a lot of information and a lot of comments that are coming through social media, and the minister corrected the wrong and removed the post.
And there's been a lot of concerns today about how long this virus can live on surfaces like cardboard and then with mail couriers. Do you have any recommendations? Should mail be in like a 48-hour quarantine or something like that before it can go out?
So what we know about this virus is that it likely can live for a period of time on certain surfaces. That will vary with the type of surface. Smooth surfaces, viruses can live, in general, viruses can live longer. On more porous surfaces, that's not so much the case. What we have to remember about a lot of mail is that it's going through a whole processing, it's being shipped, it's getting exposed to cold. So in ideal situations, the virus can survive for an extended period, perhaps for a few days on surfaces, but that's if they're not cleaned and if the surrounding environment is suitable. Things going through the mail, the cold, for one thing, is going to take care of that, so not a risk.
I'm curious, how long could this public state of emergency for health last?
Under the Act requires that this be reassessed every 2 weeks, and we will do that for as long as necessary. As I've alluded to, we have indications from other countries that this pandemic will persist well beyond 2 weeks. I anticipate this order being, quite frankly, renewed multiple times.
There have been a couple of reports, studies out in the past few days that suggest this is far more contagious than originally thought, that about 80% of cases may actually be hidden cases, people who aren't actually expressing or feeling symptoms. Dr. Fitzgerald, does this change, for example, your contact tracing processes? How does this affect how you're treating this disease?
So if somebody is infected with a disease and not symptomatic, that doesn't mean that they're contagious. So at the moment, what we know about this disease is that the people are most contagious when they're symptomatic, and generally speaking, it's most contagious when you're in close contact with somebody. So that still is the basis for our contact tracing at the moment.
Okay. The continuity of supply and what's being considered a necessary service, perhaps, Premier, you could talk to what you're, I'm thinking of, for example, food supplies coming across on the ferry, that sort of thing. What's your take on that?
Well, two things. One, if we address the supplies, that we would be using in the healthcare sector, we address that first. I mean, Dr. Ag and I, we speak really on a daily basis about the supplies, personal protective equipment and so on that our healthcare workers. I regularly check with Dr. Ag with this, but also we bring this up daily with the federal government as well. On food supplies and food security within our province, I had a number of calls yesterday with major distributors that would supply food for Newfoundlanders and Labradorians. And so far there was no questions raised by any of the major distributors on access to for food. Of course, today with the changes that we've seen within the border of with the United States, that was a big topic of the discussion today with the premiers and with the deputy prime ministers, and pleased to hear that those food services and food supplies will continue come across that border. As you know, this time of the year, a lot of the fruits and vegetables would come, and food supplies would come from the U.S. So far, the supply chain is intact, and there's the comment made to me yesterday was the inventories are full in the warehouses, but it seems like most cupboards are full in Newfoundland and Labrador, as they're telling me that it's been very robust with the purchases that have been made around our supermarkets.
If you look at an area like the Northeast Avalon, which has a fairly large population, so far there have been no cases. These sorts of lockdowns have a significant economic impact. There are people who are losing their jobs because of this, and yet there's still no evidence that the virus is even in this area. What do you say to people who say this is all a bit overblown?
So I think at this point we have time to get out ahead of this. We don't want to see an increase in cases like we're seeing elsewhere in Canada. I mean, that may still happen given the nature of this virus, but But I think if we can put some of these social distancing measures in place, the restrictions with regard to isolation for returning travelers, where our biggest risks are, I hope that we will be able to make a serious dent in the ability for this virus to take hold here.
One of the things about that, Peter, is when, with the regular calls that we're seeing across the country, is we are actually learning from what's happening in other provinces. Today, for instance, when I spoke to the Premier in British Columbia, his story was very different. And I think any of us, if we were to share the information, what we're seeing as an example in British Columbia, we would take the proactive and the precautionary approach in Newfoundland and Labrador to prevent, to contain, to delay. And so these measures that we're taking today and the work that the medical officer is doing, the chief medical officer is doing, is really in line with contain, delay, realizing that at any time you could see a spike in positives, in people testing positive with COVID-19. That is what we're trying to prevent by the precautions and the actions that we're taking today.
The one place we are still seeing a lot of people gathering is supermarkets as they stock up on supplies, and people are worried they may be touching the same thing that either workers or other people have touched. There's things like produce. What sort of precautions should people be taking in order to, and can you give us an idea of, does the virus live on things like apples or grapes or the sort of unwrapped produce that people are dealing with?
So I would assume that the virus could live on produce or other types of products in the store, just as many viruses can. We don't have a lot of evidence on that particular question at the moment, but I think we have to behave as if it can. So my recommendation would be, again, to if you're getting produce, once you bring it, obviously you wash your hands very well after you pick it up, before and after you pick it up. But once you get it home, you wash it very well as well, and make sure that you keep your food supply safe in that regard.
Okay, we'll go to the phone lines.
Yes, hi. Hello. Hi.
Hello?
Yes, we can ask for a question.
Yes.
Yes.
People have recently come back from crowded airports, like in Pearson Airport, let's say, but have only traveled inside Canada. They are reporting symptoms like dry coughing, fever, and when they try to reach 811, they are told that it's not a concern and they are not being tested. Is 811 using outdated criteria, and should there be more tests being done in Newfoundland?
So right now, our testing is focusing on international travel.